Hi, welcome to our webinar on fall prevention, balance, and stability. I'm Polly de Mille. I'm Director of Performance Services at HSS, and for those of you who may not be familiar with Performance Services, we're a team that works with individuals of all ages and abilities to help them reach their performance goals, whether that's running a marathon, being able to pick up their grandchild, just improving overall fitness, or reducing their risk of falls. So we couldn't have better people here to discuss this topic. We have two great experts in this area with us today, which is great. So first we have Dr. Andrew Creighton, who's an attending physiatrist at HSS, as well as a professor of clinical rehabilitation medicine at Cornell Medical College. And Dr. Creighton cares for patients with acute and chronic musculoskeletal and sport and spine issues, and is very dedicated to returning his patients to full function through injury prevention and guiding their return to activity. He has a special interest in golf, and he sees patients at our new Hudson Yards location as well as via telehealth. We also have Kelyssa Hall here, who's an amazing exercise physiologist and strength and conditioning specialist with over 20 years of working with people of all abilities. She specializes in working with an older population and people with complex health issues, and does an incredible job of really improving her clients' functional capacities through balance training, stability, strength, endurance. So really, we are very fortunate to be able to pick their brains on this topic. So I'd like to start with Dr. Creighton. Can you just explain if loss of balance or struggles with balance are just inevitable as we age?
So I think, first of all, thanks so much for the intro there, Polly. That was great. And I'm really excited for this opportunity. This is a topic that I feel really passionate about. I think the short answer to your question is no. There are some things that take place as we age. You know, we lose skeletal muscle mass. Sometimes we have a little bit of a decline in terms of cognition or kind of how we process things, but that doesn't necessarily mean that that has to lead to falls. And there's a lot of things I think that we can control, or that our patients, you know, can control, that potentially, you know, can lessen the risk of a fall or a loss of balance that can lead to a fall. So I think that it's not inevitable. I think that as we get older, maybe we need to be more vigilant about the things that are kind of around us or that we can control that might lead to falls, but definitely not inevitable. And I'm sure we'll get into kind of a little bit more of the specifics of those things, but you know, so.
And what are some of the causes that lead to people having, you know, issues with balance? What are some of the things that might be the underlying issues for people?
Yeah, so there's a number of things. I think the first thing that I always think about, or I always look at, or challenge a patient to kind of look at, and maybe even talk with whether it's me or their primary doctor about, are the medications that they take. I think I'm always amazed. I can barely remember to take vitamin D, and I'm always amazed with, you know, folks that come in with 10 to 20 medications, and how that in and of itself is just such an amazing part of your day and thing to kind of remember to do. So I think that looking at the medications and looking at the side effects of those medications is a big deal. And we know that a lot of times people take, for instance, medications for blood pressure that, you know, if they do too good of a job in lowering the blood pressure, sometimes that's just one example of something that could potentially lead to a fall. But there's other things. You know, obesity is one big thing. Obviously, if you've got someone that is very overweight, you know, you have more to, you know, accommodate for or be respectful. You know, you're carrying more weight, so there's more that you have to balance. If you were to have a stress or something trip, you know, there's more weight that you then have to account for. I think if someone's had a stroke, someone's had Parkinson's or has Parkinson's, if someone has dementia, I think in my world, the two things that I see a lot of that potentially can lead to a balance issue is, one, stenosis, whether that's stenosis in the cervical spine in your neck, or it's stenosis further down the spine in the low back, in the lumbar spine. Those are two things that, if the stenosis gets to more of a critical point, can lead to some balance issues. And then the other big thing that I see a lot of is arthritis. And obviously when you have different joints that are arthritic, oftentimes that can result in you needing to compensate in one way or the other, and kind of adjust how you're moving, or how kind of you're walking. So I think those are kind of a lot of the medical things that I think about. And then, there's obviously the stuff that is around you, in the house and whatnot, that potentially are obstacles that can lead to falls.
Is there any effect of having had a joint replacement on balance? Does that affect your balance at all?
I think, I think to some extent when you have a joint replacement, I'm a big believer in exercise. And I think that potentially after you get the joint replacement, there's your body obviously takes some time getting used to that. And, there's oftentimes a fairly extensive rehab process that goes on afterwards. And that rehab is really, really important, because it does help you kind of strengthen what is around the joint, but also helps, the body really works as a unit. And I think it helps kind of, the rehab itself kind of helps the whole body kind of adjust to that joint replacement. So I think the big key is for sure, we never want to fall, but definitely after a joint is replaced, definitely don't want any falls, because we don't want anything to happen to obviously what was just replaced. But that's why the rehab afterwards, after having a joint replaced, is so important. So that's a really good point.
And is there a certain age where all of a sudden, you've got to start worrying about your balance, or is this something that sort of insidiously occurs, or sort of, when should we all start thinking about this as something we need to be concerned with?
Yeah, I think you do hear age as a number. I am kind of a believer in that, in that cliche. I know 90-year-olds that can do more push-ups than I can. So I think, keeping that in mind, I guess, they kind of, what people think of is the conventionally defined as like the chronologic age that defines elderly is 65, so, and we do know that, falls are the leading cause of fatal and non-fatal injuries over the age of 65. So that's maybe, an age where, you want to start thinking about how you're going to really take an active, approach in your life to kind of help avoid, or do anything you can to help avoid falls. I always talk to patients about the fact that, like, when I'm examining them, I have one rule, and that's no falls. And then when they go home, I have one rule, no falls. Because I think as people get older, it kills me when I've got like a 95-year-old that is like, they look fantastic and everything like that. And you just know that really the only thing that can get in the way, or the major thing that can get in the way, is if there is a fall. So I think 65 maybe is the magic number. But I think just as anyone gets older in their life, they just want to always be conscious of doing whatever they can to avoid a fall.
So just curious, since you're a youngster, do you do on your balance when you exercise? Do you do exercises to focus on balance?
I do. I mean, so as you mentioned, one of the things I absolutely love is golf. And so I guess I always look at working on my balance as maybe, also potentially helping my golf game. But I do think that, in many respects, I think exercise should almost be looked at as like a medication. And I treat exercise in my day-to-day life that way. And yes, I do work on my balance, because I think balance is really a big key. Even when you're doing any sort of exercise, you want to have a certain amount of balance when you're doing it, so that, again, there isn't a certain area that takes maybe more stress in your body than another area, and could potentially lead to, an injury down the line. So I think balance is like a very underrated part of exercise for patients of all ages, really.
Okay. And then another question, if somebody wanted to, if you were examining somebody and wanted to assess their balance, are you able to do that via telehealth just as well as you can in the office?
I think that I am much more cautious doing that with telehealth, because again, in the office, I feel like I'm more in control, and it's like, while I might not be able to catch a patient, I might be able to have my hands right there, and I might be able to know certain things, position myself in a certain way that I may be able to help guide someone and help them avoid a fall. So I like I said, there's nothing that would make me feel more terrible as if I had them do something and they fell at home, and now we've got a situation where I've got someone on the ground. So, but I do think that there are basic things that you can do. I think that what I always try to do is have some sort of item that's stationary around someone when I'm testing their balance at home, for sure. So whether it's, and this may be overstepping a little bit into what Kelyssa is going to talk about here, but whether it's, something like a countertop or something like that to be near to or hold on to, or a desk or anything, so that, if we have someone, just hold on to that item, check kind of how they're balancing, and then maybe take their hands away. If they need to hold on to something again, they can grab it really quickly and they can avoid a fall. But, there are definitely different tests that we do. Having someone walk in tandem, again, that's something that I'm careful with through telehealth. I'm always in the back of my mind thinking, when I'm assessing a patient that way, or assessing their balance, what am I going to use to help them kind of accommodate, or if they lose their balance, what are they going to hold on to? So that's probably the major difference.
You can tell through telehealth a pretty good sense of somebody's ability. For
sure. You get them, just having them walk, just basic walking, I think is definitely a good step, start. And then being observant, do they have a walker around them, a cane, that type of thing, I think is always a cue to me that like something might be going on. But no, I think and we'll get into this more, I'm sure, but I think there's a big value to telehealth in terms of being able to assess things.
Okay, so Kelyssa, tell us, first of all, when you've trained people from all ages, when do you start having them incorporate balance exercises into their programs?
As early as possible. I think that the most important thing to remember is that your muscle mass degrades with age. Your mobility can decrease with age, and you can be affected by poor vision. You can have poor posture. For some of those younger kids that are sitting in front of a computer all day and they're hunched over and they don't stand up enough, you find that you have decreases in balance just because you're slightly forward. You don't even realize your center of gravity is slightly shifted forward. So you have to focus on those things early on, because what I've seen with people in their 80s and 90s who start exercise late, they can still make improvements, but if you start earlier, as early as possible, then you don't run into some of these deficits that you find later on. And I mean, I find that just simply being fearful of falling for older folks is one of the biggest challenges. They don't have a confidence. They have such a fear of falling that kind of trips them up even more than not even being prepared for the exercise. So if they practice exercise and practice balance exercises throughout their entire life, they're going to have less fear, because they're going to be more confident in their body, being able to recover through those certain things that come out of nowhere and trip them up.
So now, are there certain exercises that can help? Let's say somebody they're challenged with their balance, and they are fearful. What sort of exercises can you do that would actually help improve this? Or once your balance is bad, is it just going to be bad?
No, it's not going to be bad, and it's never too late to start. I have some examples of that later, which I'll share with you, some success stories of some older people that started later. But daily exercise can help maintain and improve strong muscles and bones, and can help keep the joints, tendons, and ligaments flexible. And that allows your body to move easier and avoid injury during everyday activities. Whether it's climbing the stairs in your house, or picking something up off the floor, carrying groceries home from the store, or being able to tie your own shoes, everyday activities require the ability to maintain balance and position. So exercises can help maintain and improve the coordination and the balance required for these daily movements. So when you talk about exercise, you can talk about different kind of buckets. And one of the first buckets is mobility. You want to maintain the range of motion in all the different joints in the body so that you maintain stability and control of positioning. Stretching the chest muscle for that person that sits all day. You want to stretch the chest muscle so that the shoulders can actually open up when you are standing up and walking, so you're not hunched over. Stretching the hamstrings and the glutes, so that the alignment of the pelvis can shift with different movement patterns, stretching the hip flexors and the quads, the muscles in the front of the hips and the thighs. They can get tight with more sedentary individuals. So if these muscles are tight, the knee may not be supported appropriately, or the posture may not be straight, causing someone to, again, to lean forward and potentially fall forward. Stretching the calves, and basically the entire body needs to be mobile. Then another bucket is strength, strengthening the muscles of the entire body to help maintain symmetrical support of the joints, which that leads to more balanced movements. If you have imbalances in the body, then you're not going to be supported appropriately for everyday movements. So we have to balance things out appropriately with our exercises, and choosing body weight exercises and movements that involve more than one joint, such as squats and step-ups, step overs, sidestepping for lateral hip strength, presses, rows, bridges, modified push-ups, or even real push-ups if you can do it. And then we talk about the next bucket, which is core strength. You know, strengthening the muscles of the trunk and the core will improve your stability and supporting the extremities through these everyday movements. These exercises include planks, side planks, dead bugs, bird dogs, rotation movements, you know, exercises that support twisting or rotational movements, which are part of everyday movements as well. We also look at squat patterns. You know, a lot of falls are due to the incorrect weight shifts as people stand up or sit down improperly. It is important to understand and practice the right way to stand up and sit down. You know, standing up from a chair, you want to place your feet flat on the floor, hip width apart, drive through the heels, and push up through the hips using the larger muscles in your posterior chain in the back of your body to help alleviate any knee problems, so that you're using the larger muscles to support you as you're standing up. And then when you're sitting down, making sure that the chair is behind you. A lot of people will sit down not realizing that the chair is a few inches over there, and then they'll fall just going into a sitting down position. So making sure that the chair is behind you and slowly lowering down with control, again, pushing through the heels and driving your hips back. So that's really
important. What would be a way of standing up that would make you more likely to fall as you stand up?
If you're leaning too far forward, if you're, you know, some people will fold at the trunk and their head is so far forward that they can't counteract that forward motion. Their center of gravity gets shifted forward and then they fall forward. Or if they're imbalanced in their muscles on one side versus the other, they may be pushing harder with their right leg. They don't realize it, and then they push themselves over to the left and then stumble off the side of the chair. Or if people don't use support on the sides of their chairs. I mean, I think, you know, the idea of having an assistive device, a lot of people resist that, but if you've been recommended to use an assistive device, I think it's important to use it. I think there's a reason for it. Strengthening and exercising is meant to kind of stave off the need for that. But if there is a need for it, I recommend people use the sides of the chair to push off. Use your walker once you stand up, and don't take steps until you're sure that you're comfortable. And then the last bucket that I kind of make the most important for balance is your single leg strength. Your single leg strength is one of the most important factors in maintaining everyday activities, such as walking and going up and down stairs. The ability to support your own body weight on one leg is important so that you can avoid that instability that may happen. So what I'm going to do is I'm going to just step back here and show you a few simple ways to improve your single leg balance. So give me just 2 seconds. Okay. So like Dr. Creighton said before, you want to have something for support next to you to hold on. That way, as you're practicing these things, you've got some support just in case. I've placed a book on the floor, and I'm just going to do simple toe taps. Tapping the foot up on the book. A lot of times people trip and fall because they're not picking their feet up off the floor. They'll trip over a carpet or a rug or an uneven sidewalk. So it's important to practice being able to lift that foot up off the floor. And you can use anything you want, something higher to progress. And then that will eventually put you into being able to do marching. Marching, you can slow it down and really increase the ability to tolerate your body weight on just one leg. And then we can go straight into standing on one leg. And you can just increase the amount of time that you can stand on that one leg and try to make both sides even so that your strength is balanced on both legs. And if you need to hold on, hold on. And you can progress this by turning your head while you're holding your balance, or even closing your eyes as you get more comfortable with standing on one leg. I hope you were able to hear me okay.
Yes, that was fine. Yeah.
That's great.
Yeah.
Good.
No, that was very helpful. But I wouldn't, you sort of realize how many components there are in balance as far as flexibility and strength and, core strength and single leg stability. So it's more than just, standing on one leg to improve your balance.
Right.
And then with your clients, do you typically advise them to practice this several times a day or daily, or what's your usual prescription for this?
I recommend in the morning and in the evening. When I see a person for the first time, I kind of have to get a feel for their feedback for the first couple of days. So I'll tell them to try it once, and then we check back in the next morning. And the feedback that they give me on how they feel, what struggles they had, that kind of guides me onto what to recommend for the coming days. But balance should be worked on regularly, especially if people are sitting all day. I think I tell my people to set an alarm on their phone for every 2 hours, and to stand up, march in place, stand right where they are, and just hold that back of the couch and just stand for 15 seconds on each leg. So I try to tell people just to pepper it into their day as much as they can, because it is so important, and it doesn't need a whole lot of time. I mean, if you're dedicating 45 minutes to exercise, you can throw all those buckets and strength and core and all of that in those, but your balance really can be targeted in just a few minutes a couple of times a day, and then be really beneficial.
Okay.
Even if it's only once a day, it's beneficial.
Now, I know you've worked with a lot of people who have actually fallen in the past and have now come to you for help. Is there some way that you sort of get their confidence back, or is that just sort of, organically through getting stronger?
I think it varies with the person. The people who haven't exercised their entire life, it's hard to sell them on, yes, I'm going to be able to strengthen you so that this stuff doesn't happen. But it doesn't really take long usually to prove these people that they can do a lot for their own balance. So it takes a good guidance and somebody who's willing to accept something new. For the younger people, they whether they're rehabilitating from an injury or a surgery, they already know the value because they've seen the decline in range of motion or their abilities to play tennis or whatever. The older people, they want to go to the ballet, or they want to go to the opera, and they want to be able to climb the stairs at the Met without a walker. And so when they can do that for the first time, and they're able to do it with just a cane and no walker, and nobody's rushing to help them stand up, that's usually when they don't stop.
And I'm just going to ask you the same question I asked Dr. Creighton about when you're working with people live versus when you're working with them in telehealth. Are there different exercises or things you do in one situation versus the other?
It can be done very easily through telehealth. I've been sold. I thought it would be a lot more difficult for a lot of my older folks, but in the last couple of months, we've found that you can be just as good at strengthening and mobility work in the house and with me on a screen, as long as I can see your body and you have that big kitchen counter standing next to you. We don't even need equipment. We can do toe taps without having anything there, just lifting the foot up and just marching. So I find that it's very effective to do it telehealth, because they're more willing to connect with what they're supposed to do. When you're in person, you're their watchful eye. They feel a little bit more protected, but when they're on their own, they realize they have to do it, and they have to do it correctly. So I think they take more value in the fact that, they're being guided, but they're really responsible for their own commitment to it. So.
Okay. So Dr. Creighton, now let's say worst case scenario, somebody does fall at home. When do they know that they should seek medical attention? Let's say they fall and they feel like, okay, actually, thankfully I dodged a bullet. I feel pretty much okay. When would somebody think, it's time to seek some medical attention for this event?
So I think, when I used to work, do more inpatient stuff, even in residency, falls were and rightfully so taken very, very seriously. It was almost like someone's chart was marked, and it really was almost an event. It was an event that was really reviewed in depth. How did this happen? That type of thing. And I think to some extent, when someone falls at home, if you dodged a bullet, awesome. And I think that, but I think that it at least warrants a call to your doctor, potentially a virtual visit or a telehealth visit, and maybe a visit in the office. But I think at least reaching out to your primary doctor, or maybe a musculoskeletal specialist that you see, whether it's a physiatrist or someone, a primary care sports medicine physician. I think reaching out, I think, is important, because I think there are different types of falls. You can have, sometimes falls are just looked at as a fall, which is fine. But I think people can fall for a variety of different reasons. You can fall because you've tripped on something, for instance, or you can fall because you passed out. And if we take those two general categories, to me, those are very, very different. And potentially, if someone's passed out, that may be an indicator that maybe they need some tests on their heart to make sure their heart's functioning okay. And at the very least, just to see their doctor, have an exam done, make sure that everything is okay, and there's no like weird neurologic findings or anything like that. And so I think that when someone passes out, that's definitely a concern that 100% of the time I think you should talk with your doctor about. And then the mechanical falls, I think, also warrant a discussion, whether that's with your doctor, with your performance specialist, with your physical therapist, your whole team. I think it's always good to have the team involved. But I think that mechanical falls also warrant a discussion too. And I think we've talked about this, but it's always interesting. And Kelyssa, I'm sure you've had this experience. Polly, I'm sure you have, where you're on these calls with these people, and you're able to see kind of the background and where they live, and you're picking up on, just in a 10-minute call, you're picking up on 10 fall risks, 10 things that could lead to a fall. So I think that in most cases, if someone falls, in fact, I would say probably all cases, you should at least kind of reach out to your doctor to have a discussion about why the fall occurred. Doctors are not looking, I think, as people get older, and what my experience has been with my own grandparents is that, a fall is almost like this thing that everyone's trying to keep quiet because they don't want to be put in a nursing home or something like that. I think doctors are always focused on making patients as independent as possible. And with, obviously, safety is the primary goal. But, if you call your doctor, they're not going to be looking to make you do anything you don't want to do. They're there to help you. And I think a fall is a perfect opportunity to kind of check in and make sure that everything is okay from a medication standpoint, from a medical comorbidity standpoint.
Yeah. And to the one final thing with the mechanical falls, I think, to your point, Dr. Creighton, when we've all been doing telehealth and you can actually see their environment, and I'll pose this to Kelyssa and to you. Do you have certain, what are sort of, if somebody's watching this and they're at home and looking around them, what are some key things they could do to their environment to make it safe and reduce the risk of a mechanical fall? So Kelyssa, why don't we start with you?
Yeah, I've had my clients focusing on decluttering, first of all. A lot of them that have an extra bedroom, I just look around the room and I say, okay, that stack of things needs to be gone by our next session. We're talking about getting rid of extra chairs. I have a client that has 20 antique chairs in her living room where she tries to exercise. And, I said, let's narrow it down to 10 antique chairs and put those either up against the wall, because, a lot of falls just occur just by misstepping and not seeing something on the floor. The clients with animals, I tell them to make sure that none of the pet toys are laying around in the middle of the floor. Or if they have grandkids over and the kids have left stuff in the floor, things like that. But that's the first thing we do is I have them set the computer on the other side of the room, and I clear the space and make sure that everything that they that they have in the way that I've pointed out, so that they're aware of it too, so that when I'm not on the screen, they know, okay, I need to minimize this clutter around the house. And also just keeping their assistive devices in each room. Some of them will walk out of the room just for something, and they don't have a cane in the other room and they'll need it, or they don't have their rollator nearby. So just making sure that they're mindful of having the right assistive devices within the house when they need it. That way, if they do feel dizzy or lightheaded from their medications, they know how to handle the situation without falling.
Great. And do you have any tips, Dr. Creighton?
Yeah, I think the two big ones for me, this was a battle I never won with my grandmother, but you know, these patterned rugs that everyone, it seems like, you know, these throw rugs, you know, that was always, my grandma had about 20 all over the house, and it was just like, oh my gosh, like it was always, we were all holding our breath every time, you know, she got close to but you couldn't get them away. I would recommend really evaluating how many throw rugs you need around, and the pattern rugs and things like that. And then the other thing that I talk to patients about is making sure that your showers and everything like that have a grab bar or a safety bar. And those are, I think, you know, two major, I think. So it's interesting. I did some of the triaging calls when we had the ortho urgent care, and I think a number of the falls I heard of were in the bathroom and getting in and out of the shower, that type of thing. So I think if you have a safety bar, I think that would be another thing that I would really recommend.
Yeah, even wearing the right footwear. You know, I
Yes.
have people that have been wearing these
Totally agree.
slippers, and then they tell me, or I visually see them tripping in their slippers. So during this quarantine, a lot of people I don't think have even put on their shoes. They're just wearing their house shoes for 3 months. So that alone has changed their positioning and their use of their legs, because they're walking different on different shoes without support, without their orthotics. So just having the right footwear and having the right glasses, making sure their vision prescriptions are up to date. You know, if you have poor depth perception, you're not necessarily going to see those things in your way, or you're going to mismanage the space that you need to move.
Well, those are great points. I mean, I think we can realize that balance and stability and falls are really multifactorial, and it's not always just tripping over something. That, you know, it's the culmination of a lot of things, from the environment you're in to your strength and your core strength and your flexibility and practicing balance. So thank you guys for really shedding some light on this topic. I think it was very helpful in terms of getting people to understand little things they could maybe do at home, and also maybe making their environment safer. So thank you. And
well, and I just want to share one success story. I have a client that I recently started with last year. He's 94 years old, and he never exercised his entire life. He just did safaris and hikes and active exercises. So he was having just regular issues with his spine and cramping, and the first day I saw him, he could stand on his right leg for 3 seconds and his left leg for 8 seconds. So there was a little imbalance there. And fast forward 3 months, and I'm on the train, of course, pre-coronavirus, that is, going uptown on the A train, and I look over, and there he is, standing on the train, not holding onto the pole, standing there as sturdy as could be. And so, you know, I guess the message there is it really is never too late, as long as you prioritize the right things and seek guidance when you don't know what to do, and we can definitely prevent falls.
Yes. Well, no one could be in better hands than with either of you two. So,
Polly, did we forget anything?
I don't think so. Yeah, you have anything else that you think you wanna throw in there, please do. But I think
No, I know you're an expert too, so I didn't know if we forgot anything.
Dr. Creighton, when you have a client who hasn't exercised their whole life, how do you convince them to the importance of it?
I think you try to, I think exercise, I try to relate it to other things that I think exercise is helpful with. So, I think it's it's incredibly helpful for a very sharp mind. I think it's very important for a patient's mood. I think it's very important for their cardiovascular health. And so I try to get creative in terms of talking about where other areas where it can be helpful in their life. And then I also talk about how just to be very functional in their day-to-day life, they need to have a certain ability level and certain activity level to be able to just function. So I think my whole life as a physiatrist is focused on function, and I really try to take that approach in terms of, okay, I don't need you running marathons. I don't need you being, the most athletic person in your family, the most fit person in your family, but I'm focused on your longevity and your function in your day-to-day life. And I think exercise is so important for that. I always say the motion is the lotion, and I think HSS's mantra of how you move is why we're here is so important, for everyone's day-to-day life. So I try to get creative in terms of how I talk about it. I think that's my one strategy.
And I would say, as an exercise physiologist, that there is nothing more powerful than someone's physician prescribing exercise. So I can tell people till I'm blue in the face, and I'm sure Kelyssa's had the same experience of the importance of exercise and at any age. And but when that physician says you need to do this, and especially if they write it on a prescription pad,
I was just going to say that.
All of a sudden, it's a game changer, and
Right.
So you really should. I'm glad to hear you say that, because it really is powerful when it comes from a physician.
Yeah, well, I will keep saying it for sure.
All right. Well, listen, thank you both. This was very fun for me. So thanks for sharing all your knowledge.
Thank you.
Welcome. Thank you for having us.
Thanks so much.
Thank you. All right. Take care.
All right, you too.
All right.
Okay. Bye-bye.
Bye.